You may have heard of the Nurse Licensure Compact. For states who've joined the Compact, nurses are allowed to practice in any other Nurse Licensure Compact states without obtaining additional licenses. Let's take a look at what that would look like in Minnesota. In Minnesota, we pride ourselves on providing high-quality healthcare for all patients, no matter their zip code. Unfortunately, the Nurse Licensure Compact would change that. Here's how. The Compact would reduce accountability and oversight for nursing standards in Minnesota. That means the Minnesota Legislature and the Minnesota Board of Nursing would no longer be able to set and monitor nursing standards in our state. Instead, these decisions would be made by a third party behind closed doors. This would also create challenges for Minnesota to enforce our own licensure requirements effectively, especially in areas like our continuing education requirements for nurses. For example, in Minnesota, we require cardiac nurses to stay up to date on the latest pacemaker technology. In a compact state, like Wisconsin for example, there's no requirement. Who would you prefer to be looking after your heart? And in rural Minnesota? If Minnesota were to become a compact state, families in rural Minnesota would be at risk of losing access to safe and quality care. One of the goals of the Interstate Commission behind the Compact is to replace individualized care by registered nurses in person and in the patient's local community with computerized healthcare. Minnesotans everywhere deserve in-person care options in their communities. The nurse staffing crisis continues across the country, no matter if a state is in the Compact or not. The Compact makes it easier for nurses to leave Minnesota and practice elsewhere. Minnesota families cannot afford to lose highly skilled and experienced nurses from our communities. Can we risk these serious implications that the Compact would bring to Minnesota? Together, let's fight for improving patient care for all families in our state. Saying no to the Nurse Licensure Compact is the first step.